Well, as Amy described, the causes of and relationship between obesity and food insecurity are complex and multifaceted. And we know that individual behavior changes are needed before rates of obesity will decrease. But when talking about obesity and food insecurity, place really does matter. And so for the rest of the day, we're going to be talking about strategies that communities can use to increase access to healthy foods. We are not going to be presenting an exhaustive list of all the strategies that can be used, but some ideas that hopefully help all of you start to think about things that can be done in each of your own communities. Policies can be changed to increase access to a variety of healthy foods, including the types of foods listed on this slide. But for the purposes of today, we're really going to focus on looking at increased access to fresh fruits and vegetables. We know that consumption of fresh fruits and vegetables is important to good nutrition and plays a role in weight loss. And two ways to increase consumption is to make sure that fruits and vegetables are available in communities and that the costs of fruits and vegetables are reasonable, not only to consumers, but to those that are growing fruits and vegetables, those that are distributing those and selling them as well. The strategies that we'll be talking about are changes that can be made to policies, systems, and environments that increase access to healthy foods. These strategies are effective because they meet the needs of the community, and they engage stakeholders from across disciplines. They all include ways to be able to measure success and impact. And again, I can't underscore enough that the strategy ends up being appropriate and effective because it isn't a kind of a blanket strategy that's used in different communities, but it really is designed to meet the needs within that community. The recommendations on this slide were developed by the Centers for Disease Control and Prevention and the Institutes of Medicine as ways to reduce obesity. And what's important to note is that these recommendations are also similar to those that are recommended to reduce food insecurity. I know that many of you in the audience today are thinking about access to healthy food from primarily a perspective of reducing obesity or from thinking about food insecurity. And what I think is important to think about is that although you may be coming from different perspectives, there's a lot of convergence about the types of strategies that can be used in communities then to address these issues. And that offers a lot of opportunities to be able to do more work, to work across disciplines. One way to increase the availability and affordability of healthy foods is to enhance access to public nutrition programs and improve policies. There is evidence that participation in federal school lunch and breakfast programs can reduce the risk of obesity among students. Studies have shown that students who participate in the school breakfast programs have a reduced risk of body mass index, or BMI. And in addition, research has shown that children are more vulnerable to rapid BMI gains in the summer months when they don't have access to those types of programs. Many of you probably know that the USDA is gathering comments to a proposed rule change to the national school and breakfast programs. This would do a variety of things, including, for the first time, establishing some calorie maximums for school meals that are served. It's important to note that although there's some fear that by offering healthier foods, participation in school lunch programs will decrease, some studies in Minnesota have shown that that isn't the case and that healthier alternatives can be offered without a significant increase in the cost of those meals. Another strategy to increase the availability and affordability of healthy foods is to increase the number of community gardens and farmers markets. Some of the ways that farmers markets can be encouraged, or that residents can be encouraged to go to farmers markets are listed on this slide. Another thing that's important to think about is potentially trying to coordinate promotions or sales of farmers markets to align with kind of the monthly cash flow within a community. So if there are a number of low-income residents that receive some sort of food support, to think about timing promotional information or sales at the food market at points in the month when residents are more likely to have money to be able to spend on fresh fruits and vegetables. One place where farmers markets and community gardens has really taken off might surprise you. The city of Detroit has been hit hard by the housing crisis and the recession. Their population has decreased dramatically from 1.8 million to now less than 900,000 residents. And there is according to one source, a 27% combined rental and housing vacancy rate in the city, leading to a number of abandoned lots and abandoned homes. What is seen by a huge problem to some, though, was an opportunity for a nonprofit in Detroit, and they've been able to create an initiative to train people how to grow their own food, to provide residents with low or no-cost seeds and plants, opportunities to be able to borrow tools and other resources, so that now the number of community gardens has increased in the city to 500, and that's up from just 80 3 years ago. The food grown by local residents has also been sold at farmers markets under this Grown in Detroit label. Another opportunity to increase the availability of fresh fruits and vegetables is by improving the availability of supermarkets. That can be done by helping residents have transportation to be able to get to supermarkets outside their neighborhood if one isn't present within their own neighborhood, or to create incentives to encourage developers to build grocery stores in food deserts. The Fresh Food Financing Initiative out of Philadelphia is one example where incentives have been provided to developers to create supermarkets in underserved neighborhoods. They were able to create a fund of $120 million due to a study that was able to demonstrate that low-income residents were less likely to live near supermarkets and more likely to have health conditions related to their diet. And through this initiative, developers can receive grants or loans to cover the cost of construction, capital expenses, and other soft costs. And in Philadelphia, they have been able to increase the number of supermarkets available and create or maintain 5,000 jobs in the community. This type of initiative has also been started now in Illinois, Louisiana, and New York, and Texas is considering a similar strategy. This concept was also adopted by President Obama in his 2011 budget proposal. Different types of incentives can also be offered to small business owners to encourage them to change the types of items that they're selling in their markets to include more fresh fruits and vegetables. The Good Neighbor Project in San Francisco is one example of this. They've been able to work with local store owners to give them essentially kind of a bundle of different incentives so that they will receive local advertising, energy efficient retrofits, business training, opportunities to buy cooperatively so that they can get fresh fruits and vegetables at a lower price, and participate in a branding campaign. If they increase the amount of shelf space that they allocate for fresh fruits and vegetables to 10 to 20%, reduce the amount of advertising and tobacco, the amount of advertising for alcohol and tobacco in their stores, and keep their stores clean. As I said before, selecting the appropriate strategy really depends on understanding the needs of the community. There isn't a single best practice approach that works in all communities, and so it's really up to stakeholders to work together with residents to understand the community needs and identify the best solutions. Some initiatives will require significant upfront investments, but policy changes can be a really helpful way to make sure that these changes can be sustained over time. We also have great examples of work that's being done locally to increase access to healthy food. I'm sure that all of you know that we're in our second year of the Minnesota Minnesota statewide health improvement program. And through that initiative, communities all over the state are working to increase community gardens, farmers markets, and a variety of other strategies to increase access to healthy foods.